If you are over the age of 60, this might be one of the most important messages you hear this year. Today, we are talking about something that is far too common and far too dangerous to ignore. It is not about a specific illness or a new medication or even a medical breakthrough. It is about the words your doctor says to you, the phrases that may seem harmless on the surface, but could be red flags. Words that, if left unquestioned, can lead to missed diagnoses, wrong treatments, or even serious harm. This video is for you if you have ever walked out of a doctor's office feeling dismissed, unheard, or unsure. Maybe you have felt like your symptoms were brushed aside. Or maybe you have been told that what you are feeling is just part of getting older. What if I told you that 5 simple phrases, 5 things doctors commonly say, could be warning signs that you are not getting the care and respect you deserve? That is exactly what we are uncovering today. And I want to be clear, this is not about blaming doctors. Many doctors care deeply and work hard. But when it comes to treating older adults, sometimes even good intentions can lead to poor communication or dangerous assumptions. 1. At your age, that's just normal. Let us start with the first phrase. It is one of the most common things seniors hear at the doctor's office, and one of the most dangerous. At your age, that's just normal. Now, on the surface, this might sound harmless, maybe even comforting, but in reality, it is often used to dismiss real concerns without proper investigation. Imagine this. You are 75 years old. You have been feeling tired lately, more than usual. You are experiencing shortness of breath when climbing the stairs. You go to your doctor, explain everything, and he says, well, that is just part of getting older. No tests, no follow-up questions, just a smile and a reminder that you are not 20 anymore. Here is the problem. That kind of thinking is not only lazy, it is dangerous. Getting older does come with changes. We all slow down a little. Our bodies shift. But that does not mean that every symptom should be blamed on aging. Pain, fatigue, memory loss, dizziness, or changes in weight, these are not just normal. They are signals. They are your body's way of saying something needs attention. Let me tell you a story. My mother was 78 when she began complaining of back pain. Not just discomfort, sharp, shooting pain that woke her up at night. She told her doctor. He barely looked up from her chart and said, "At your age, that is expected. Your spine is just getting old." That was it. No scans, no blood work, no physical examination. 2 months later, she was rushed to the hospital. She had a spinal compression fracture caused by advanced osteoporosis. It could have been caught early. It could have been treated before it caused so much pain. But it was missed because her symptoms were brushed off as normal for her age. And she is not alone. Thousands of seniors every year are misdiagnosed or undiagnosed because their symptoms are attributed to aging instead of being properly explored. This is a form of what we call ageism in healthcare. When medical professionals assume that because you are older, your health problems are less important or less treatable. That is not just frustrating, it is unacceptable. You have the right to thorough, respectful, and thoughtful medical care, no matter your age. So what can you do if a doctor tells you that something is just normal for someone your age? You ask questions, you push back politely but firmly. You say, "Can you help me understand what else this might be?" You say, "Is there a test we can do to rule out something more serious?" You say, "I do not feel normal, and I would like to know why." These are powerful words. They put the focus back on your needs. They make it clear that you are not satisfied with guesswork or assumptions. And if the doctor still brushes you off, you get a second opinion. You find someone who will listen. You do not settle. Remember, aging is not a disease. It is a stage of life. And just like any other stage, it deserves careful attention and respect. You are not being difficult by asking for answers. You are being smart. You are being proactive. You are taking charge of your health. And that is one of the most powerful things you can do. So the next time someone tells you, at your age, that is just normal, take a breath, then speak up. Because your body is talking to you, and it deserves to be heard. 2, let's just prescribe something and see what happens. The second phrase that should make you stop and think is this one. Let's just prescribe something and see what happens. It might sound like a reasonable first step. After all, some treatments do involve trial and error. But when this phrase is used without proper testing, without asking the right questions, or without considering your medical history, it becomes a serious red flag, especially for older adults. Let me explain why this is so dangerous. As we get older, our bodies process medications differently. Our kidneys, liver, and digestive systems slow down. Our balance becomes more sensitive. And most importantly, we are more likely to be taking several medications at once. Some people over the age of 65 are on 5, 10, or even more different prescriptions every single day. That means one new drug, prescribed casually without much thought, can create a dangerous domino effect. Let me tell you about George. George was 72 when he started having trouble sleeping. He would wake up in the middle of the night, unable to get back to sleep. It was frustrating, sure, but manageable. When he brought it up during a routine visit, his doctor said, "Let's try something mild. This should help. Let me know how you feel." No review of his current medications. No questions about possible causes like anxiety, diet, or chronic pain. Just a quick prescription and a handshake. That night, George took the pill. The next morning, he felt groggy, a little off balance. By the second night, he had trouble walking steadily. On the third day, he fell down the steps in his garage and broke his hip. When they looked into it later, they discovered that the sleeping medication he had been given interacted with 2 of his heart medications. It caused dizziness, confusion, and loss of balance. The fall could have been prevented. The fracture could have been avoided. But no one had checked. This is not just George's story. It happens all the time. When a doctor prescribes something just to see what happens, that tells you they are guessing, that they are experimenting on your body instead of understanding it. Now, there are times when trying a new medication makes sense, but even then, it should never be done casually. It should come after a thoughtful conversation, a review of your current medications, and a clear explanation of possible side effects. So what should you do if a doctor says this to you? Start by asking questions like these. Why this medication specifically? What are we treating here? What are the risks and side effects, especially with the medications I am already taking? How long should I take it before we reassess? Write these questions down. Keep them with you. Use them every time a new prescription is offered. You can also ask for written information. Say, "Mom, can you give me a handout or something in writing about this medication?" That gives you time to review and do your own research. And if something feels rushed, if the doctor seems dismissive, do not hesitate to say, "I would like to take some time to think about this before starting anything new." You are not being difficult. You are being responsible. Your health is not a test case. You deserve treatment that is based on evidence, not guessing. You deserve a doctor who sees you, not just your age or your chart or the 10-minute window on their schedule. So the next time someone says, "Let's just prescribe something and see what happens," take a step back, ask questions, demand clarity, because guessing is not care, and your body is not an experiment. 3, you do not need to know all the details. This third phrase is one of the most quietly harmful things a doctor can say, especially to someone older. You do not need to know all the details. At first, it might sound like the doctor is trying to protect you from confusion. Maybe they think the information is too complex, too technical, or not important for you to worry about. But in reality, what they are saying is this: I do not think you are capable of understanding. I do not have time to explain. I do not see you as a partner in your own care. Let us pause there, because that is a serious problem. You have every right to know what is going on with your body. You have every right to understand the diagnosis, the treatment plan, the risks, the benefits, and the alternatives. This is not just your right. It is your legal right. Protected under medical consent laws in the United States. Let me share a story with you. Linda was 75. She had a long history of high blood pressure and occasional chest discomfort. One morning, she had a strong episode of chest pain and went straight to the emergency room. After a few tests, the doctors told her she needed a procedure. Not in a week, not tomorrow, that very day. It was called an angioplasty. A small balloon would be inserted into her artery to restore blood flow. Linda was frightened. Naturally, she had questions. She asked the cardiologist, "Are there other options besides surgery?" He said, "Do not worry about that. This is what we do." She asked, "What are the risks? What are the chances this will fix the problem long term?" He said, "You do not need to know all the details. It is better not to get overwhelmed." Let me be very clear. That is not acceptable. Linda agreed to the procedure because she felt she had no choice. She did not feel empowered to speak up. She did not feel she had time to think. And in the end, she developed complications, a serious infection at the insertion site, and a longer recovery than expected. Later, when she saw another doctor for follow-up, she learned that there was actually a non-invasive medication approach that could have been tried first. It was not a guarantee, but it was a real option, one that was never explained to her. Why not? Because someone decided she did not need to know. This is not rare. Many older patients are spoken to as if they are fragile or easily confused, or simply not worth the time it takes to explain things properly. And yet, in my experience, seniors are some of the most thoughtful, informed, and careful medical decision makers you will find. You have lived through decades of change. You have raised families, run businesses, managed crises. You can understand your own health if someone takes the time to explain it with respect. So what can you do if a doctor says something like, "You do not need to know the details"? First, remember that this is your body, your life, your decision. Second, do not be afraid to interrupt and say, "I want to understand what is happening." Can you explain that in simpler terms? I would like to know all of my options, even if they are not ideal. Please slow down. I am not in a rush. I want to make an informed choice. You are not being pushy. You are being responsible. This is not about questioning the doctor's intelligence. It is about making sure they see you as a human being, not just a task to finish. You can also ask for written materials or ask if they can explain things again with a family member present. That way, you have someone else to help you process the information. You can say, "Can you write that down for me, or would you mind repeating that for my daughter on the phone?" A good doctor will never mind repeating themselves. A good doctor respects questions. A good doctor wants you to be involved because they know that patients who understand their care plans are more likely to follow through, recover faster, and avoid future complications. If a doctor seems irritated, impatient, or dismissive when you ask to understand your own treatment, that is not a sign that you are a difficult patient. That is a sign that you may need a different doctor. Your mind still matters. Your voice still matters. And your health decisions should always be made with you, not for you. So the next time someone says, "You do not need to know all the details," I want you to hear this instead. Yes, you do. Yes, you deserve to know. Yes, you have every right to understand and choose what is best for you. 4. It is probably nothing. Let us just wait and see. The fourth phrase on our list might sound calm and reassuring, but do not be fooled. When it is used without proper testing or follow-up, this phrase can be one of the most harmful of all. It is probably nothing. Let us just wait and see. Now, there are times in medicine when waiting is the right move. Some conditions do improve on their own. Some symptoms truly are minor. But when you are over the age of 60 and your body is sending you clear signals that something is off, being told to just wait can mean missing your chance to catch a serious illness early. Let me tell you about Carl. Carl was 68 when he started having a dry cough. It was not violent. It did not come with a fever, but it was constant every day for over a month. He also noticed he was losing weight without trying and feeling more tired than usual. Carl went to his doctor and explained everything. The doctor listened for a few moments and then said, "It is probably just allergies. The seasons are changing. Let us just wait a few more weeks and see what happens." No chest x-ray, no referral to a specialist, no lab work, just a pat on the back and a reminder to rest. 3 months later, Carl was diagnosed with stage 2 lung cancer. The early warning signs were there. But because they did not seem urgent, and because Carl was not coughing up blood or doubled over in pain, they were brushed aside. Unfortunately, this happens all the time, especially with seniors. Many doctors are trained to look for extreme symptoms. They are used to thinking in black and white. Either something is an emergency or it is not. But for older adults, symptoms can be subtle. A mild cough might be the start of something serious. Unexplained weight loss could be more than just a diet change. A headache that lingers might be the sign of something neurological. And yet, over and over, seniors are told, "Let us just wait and see." Now, again, I want to be fair. There are situations where waiting is appropriate, but the key is this: waiting must be done with a plan, not passively, not indefinitely, and never without a clear explanation. So what should you do if a doctor says this to you? First, ask for specifics. Say, "What are we waiting for exactly, Mom?" Say, "What would need to change for you to take this more seriously?" Say, "If this is still happening in 1 week or 2 weeks, what is the next step?" Say, "Can we do some basic tests now just to rule out anything serious?" It is not about demanding a full battery of tests for every symptom. It is about not being dismissed. It is about making sure your doctor is treating you like someone whose time and health matters. If you are concerned about a symptom and it is affecting your daily life, your doctor should be too. Sometimes waiting is the easy way out for them, but it should never come at your expense. Another thing you can do is keep a health journal. Write down your symptoms, the time they started, how often they happen, and how they are changing. That way, if you do need to come back, you have clear documentation. It helps the doctor take your case more seriously and may reveal patterns that are easy to miss. And if your gut is telling you something is wrong, trust it. You know your body. You have lived in it for decades. You can tell the difference between something mild and something unusual. When you hear, "Let us just wait and see," you do not have to panic. But you also do not have to accept it blindly. Ask for a plan. Ask for a timeline. Ask for evidence-based decisions, not assumptions. Your health is not a guessing game. It deserves attention, even if the symptoms are subtle, because sometimes the early action makes all the difference. 5. That is just anxiety or depression. You are overreacting. This final phrase may be the most painful of all, especially for older adults who are already feeling uncertain or dismissed. That is just anxiety or depression. You are overreacting. Let us be clear. Mental health matters. Anxiety and depression are real, and they can absolutely affect seniors. But when doctors use this phrase as a shortcut, when they label your symptoms as emotional without properly evaluating the physical cause, they are not helping. They are minimizing you. This phrase is often used when the doctor cannot immediately explain what is happening. Instead of digging deeper, they jump to an emotional explanation. They assume your symptoms must be in your head. And that is not only unfair, it is dangerous. Let me tell you about Julia. Julia was 74 when she started noticing strange changes in her body. Her hands began to shake slightly when she reached for a cup. She was forgetting the names of people she had known for years, and she often felt dizzy when she stood up. She told her doctor, who listened politely, then leaned back and said, "This sounds like stress, maybe some mild depression. It is probably nothing serious. You are overreacting." No neurological exam, no memory test, no blood work, nothing. Julia went home feeling embarrassed. She wondered if maybe she was overreacting. She did not talk about it with her children. She did not push for more answers. Months later, the symptoms worsened. Finally, she saw a different doctor, a neurologist, who diagnosed her with early stage Parkinson's disease. If her symptoms had been taken seriously from the beginning, she could have started treatment sooner. She could have made adjustments to her lifestyle, taken medications, and planned for her future. But because her concerns were labeled emotional, she lost valuable time. Unfortunately, this happens too often. Many women, especially older women, are told that their symptoms are due to stress. Many men are told to tough it out or not worry so much. And seniors as a group are particularly vulnerable to being labeled as overly emotional, forgetful, or fragile. But here is the truth. You know your body. You know when something is wrong. You have earned the right to be taken seriously. So what should you do if a doctor tells you your symptoms are just anxiety or depression? Start by asking for specifics. Say, "What makes you think this is emotional and not physical?" Say, "Can you explain what you have ruled out so far?" Say, "Can we do some tests to be sure?" Say, "I would like a referral to a specialist to get another opinion." If you are open to it, you can also ask, "Is it possible that I have both physical and emotional symptoms?" Because sometimes anxiety and physical illness do happen together, but they should never cancel each other out. You should never be made to feel like your concerns are not valid just because you are scared or emotional. Fear is not a diagnosis. It is a signal, and it deserves attention. It is also important to remember that mental health conditions like depression and anxiety are medical conditions too. If a doctor genuinely believes you may be experiencing either one, they should treat it with the same seriousness as a physical illness. That means offering support, therapy options, or referrals, not just dismissing your words and sending you out the door. Being older does not make you less credible. Having emotions does not make you unreliable. And being concerned about your health does not mean you are overreacting. It means you care. The best doctors listen with empathy. They know the difference between being thorough and being dismissive. They take time to explain. They respect your experience and your instincts. And if your doctor does not do those things, you have a choice. You can speak up. You can ask more questions. And if needed, you can walk away. Because your health is not imaginary. It is not emotional. It is real. It is yours. And you deserve to have it taken seriously. Always. Now that we have gone through all 5 red flag phrases, let us bring everything together in the final section. We will talk about what you can do moving forward to protect yourself, advocate for your care, and make sure your voice is heard. Let us wrap this up with strength and clarity. You deserve better, always. If you have made it to this point, thank you. Thank you for caring about your health. Thank you for standing up for your voice. And thank you for trusting yourself enough to learn what so many people never hear, that you have the right to be respected, listened to, and taken seriously, no matter your age. We have talked about 5 dangerous phrases that doctors sometimes say. Number 1, at your age, that is just normal. Number 2, let us just prescribe something and see what happens. Number 3, you do not need to know all the details. Number 4, it is probably nothing. Let us just wait and see. And number 5, that is just anxiety or depression. You are overreacting. Each of these phrases may seem small in the moment, but as we have seen, they can lead to delayed diagnoses, inappropriate treatment, missed opportunities, and emotional harm. You are not just a patient. You are a whole person, a person with a lifetime of experience, a person who knows their body, a person who deserves care that is thoughtful, respectful, and complete. So what now? First, trust your instincts. If something feels wrong, speak up. Second, ask questions. Good doctors welcome them. Third, bring someone with you if possible. A second set of ears can be powerful. Fourth, take notes, ask for explanations, and follow up. And finally, if you are not being heard, walk away. Find another doctor, because your life matters too much to settle for silence or shortcuts. You have earned the right to advocate for yourself. You have earned the right to be informed. And you have earned the right to say, no, that is not good enough. If this video helped you, I hope you will share it. Share it with your spouse. Share it with your siblings. Share it with your friends or your caregiver. You might help someone catch something early. You might save someone time, stress, or even their life. And if you have ever heard one of these 5 phrases from a doctor, I would love for you to leave a comment. Let us create a space where older adults can support each other. Because this is not just about one person, it is about a generation of voices that have too often been ignored. Subscribe to Elders Insight for more videos like this. Videos that honor your wisdom, protect your well-being, and speak to you with respect. You are not too old. You are not invisible. You are not overreacting. You are the expert on your life. And we are here to help you live it fully with clarity, dignity, and strength. Until next time, take good care of yourself. And never stop asking for what you deserve. You are worth it, always.